Three souls on board, 2:30 on the fuel, 6 minutes to Aiken. LZ is ready for you.
Hi, I'm Scott Sampey. I am the Vice President of Ambulance Services at North Memorial. Our ambulance services include air care, we have ground services, and also community paramedicine. North Memorial here is a level 1 trauma center. We also offer neonatal services and heart services and stroke and all those things. The community we serve at North is all over our state of Minnesota as well as Wisconsin. You know, with air service, you can get out so much farther. And interestingly enough, our aircraft are placed in areas that don't often even bring patients to North. North really supports all these different communities across these states to support the local community, support our ambulance services there, and quite frankly, to help the people.
When North Memorial comes to a community, we stay in that community and we become a part of that community. So we're committed to the citizens, to the local hospitals, to the local first responders. They know that they can trust us to get their patients taken care of and to the most appropriate care.
You know, when you really look at air medical transport, the difference between ground in general is speed. You know, we can directly go from point A to point B, as well as often the equipment we carry is a little more intense, a critical care unit, carry blood and things that we don't always carry in an ambulance.
In rural Minnesota, they're hours away from a level 1 trauma center. So we carry at North Memorial Air Care whole blood and packed red blood cells, which are life-saving treatments to these trauma patients. As trauma patients get cold, they have increased mortality. So North Memorial, we've implemented active rewarming for our trauma patients. We have a warming blanket that actually heats up, and we warm all of our fluids and all of our blood for our trauma patients to help combat the traumatic hypothermia and hopefully improve their survival outcomes.
And that put together really can get people to where they need to get, to a trauma center, to a stroke center, to the heart care they need. So those are the things where aircraft are so important. It's part of our mission.
AW109S has served us very well. Very fast, very powerful aircraft. I think our crews would agree that it works well for them.
As a clinician, it's nice because you can stay safely belted and everything you can reach from your hands. The speed of it is nice when you have really sick patients. We like to get to the hospital as fast as we can, so we definitely appreciate the speed in the back there.
Simulator's been very beneficial in cost savings and kind of given us more focused training with new pilots coming into the mix. It's also been really beneficial with our IFR program. If you don't come from an IFR background, it's been a really useful tool to kind of break down different phases of IFR flight and checklist usage. All those kind of things can tackle in a simulator really well and slow things down to the pilots.
When people need a helicopter, for instance, it might be one of their worst days they've had because they need, you know, that type of care. And so we all work as a good community, both air and ground. Everybody works with each other to service the patients, the customers as best as we can.
So our team is made up of paramedics and RNs. We are 100% advanced certification clinicians at our program, so we're pretty proud of that, which means all of our clinicians have either a certified emergency nurses certification, and all of our paramedics have certified flight paramedic certifications.
We see flight requests as a collaborative effort. It's a team effort. We're talking about weather when we show up for our pre-shift brief, and we're talking about it as weather changes throughout the shift.
When a call comes in, all it takes is one person to say, I don't feel safe. And that could be, there's something about the weather that makes me unsafe, there's something on the aircraft that makes me feel uncomfortable, but it only takes that one person to say, nope, this doesn't feel right. And that actually applies throughout the whole call. So even if they're on the way to the call and the weather starts to change, one person says, I feel unsafe, we should turn around. That mission is aborted, and they turn around and then they talk about it and figure out, what happened, what was the weather. And then before they ever take off, if somebody says, I'm uncomfortable, that call gets put on hold and they talk about it and they look at the weather patterns, and somebody might say, what did I miss? And they learn from it, and then I think it makes us a better and a safer program. So as we continue to look at how we serve our communities, it all starts with we become a part of the community, right? So we continue to support our first responders, we continue to support our fire departments, and really develop those relationships with them. As medicine continues to change, so does medicine in the helicopter. So we're bringing ultrasound to patient care bedside, to the roadside. We're bringing point of care testing. We can run labs in the back of an ambulance on the way to the helicopter. So expanding those clinical care capabilities and bringing that emergency room, ICU type level care to our patients in the field is really how we're going to expand.
This is a very needed and special job, and we need to continue that for the future.